Hi, my name is Sarah, and I'm the Director of Patient Care at Pure Wellness Medical. And today we're here with Dr. David Suarez, and we're talking a little bit about why women seek hormone replacement therapy. So I wanted to ask you, Dr. David, what are some of the common reasons women seek hormone replacement therapy?
Well, there's so many reasons. There's so many benefits. And all we really know about is mainstream medicine pushes the bad parts about it. So you have a decrease in libido or your sex drive, fatigue, night sweats, sleep problems, trouble concentrating, can't get the results out of doing exercise that you'd like. You can have an increase in body fat, decrease in strength. Obviously, you have those perimenopause and menopausal symptoms, hot flashes, night sweats. You can have intimacy issues, mood swings, and osteoporosis. And most of all, just wanting to feel better, have a better quality of life.
Okay. And what are the benefits of bioidentical estradiol?
Okay, well, I'm glad that you mentioned estradiol, not estrogen. And there's a difference. Estrogen is made up of different estrogens, estradiol, estriol, and estrone. And estradiol is the one that has been studied that has the most benefits. So anything that we do prescribe, we prescribe it as an off-label use to improve symptoms and improve the quality of life. And there was a study that showed that estradiol increases your HDL, which is your good cholesterol, and decreases the LDL, which is the bad cholesterol, compared to placebo. And that same study showed that there was an increased sensitivity to insulin and improved fasting blood sugar, improved insulin levels, and improved hemoglobin A1C, which is your 3-month daily blood sugar.
Okay.
In addition, it increases lean body mass, strength,
Oh,
improves endurance and exercise tolerance, decreases cholesterol, and protects against cardiovascular disease like hypertension by decreasing the cardiac intimal medial thickness and vasoactive reactivity. So it allows the vessels to expand more, improves cognition and memory, prevents against tendon and joint degeneration, improves bone density, and prevents osteoporosis and osteopenia, prevents skin atrophy, and prevents and treats depression. The other thing, it's also been shown to prevent multiple sclerosis, Alzheimer's, and dementia.
okay, wow. That was amazing, but can you tell me some of the benefits of bioidentical progesterone as well?
Well, again, off-label use to improve symptoms and quality of life. Progesterone is an amazing female hormone. It's used to treat abnormal menstrual cycles or uterine bleeding. It helps to maintain pregnancy, reduces changes in the lining of the uterus for women that are taking estrogens. Studies have shown that compared hormone replacement containing progestin, which is not progesterone, to women that are taking the bioidentical progesterone, experience significant improvements of vasomotor or hot flash symptoms, somatic or physical complaints, anxiety, and depressive symptoms. Progesterone is also synergistic or helps the estrogen's effects on bone and lipids. There's a decrease in incidence of uterine and breast cancer, coronary artery disease, like I said earlier, osteoporosis, symptoms of fibrocystic breast disease, ovarian cysts. It reduces fluid retention and bloating. It's also been shown to decrease headaches, which is another thing that you really wouldn't attribute to progesterone.
Okay. And can you also tell me some of the benefits of bioidentical testosterone for women? Is that testosterone for women? That's always a question I had. So what are some of the benefits of that?
Well, Testosterone improves your red blood cell production. A lot of women tend to be anemic, especially due to heavy periods for their whole lives. So what it does is it increases erythropoietin production in the kidneys. Erythropoietin then goes to your bone marrow and increases your red blood cell production. It also improves your sense of well-being, your energy, your strength and endurance. It helps decrease body fat, your visceral fat, increase your lean body mass. Again, improves your bone density, improves your sexual function, and increases clitoral sensitivity. It also prevents diabetes, heart disease, increases collagen production to improve your skin thickness and improves skin texture, and also decreases wrinkles.
Okay, that's all you have to tell me. Okay. Can you tell me a little bit more about the benefits of bioidentical thyroid replacement?
Well, thyroid, we talk about desiccated thyroid, a dried thyroid, which is made up of liothyronine, which is T3, and levothyroxine, which is T4. So it increases fat breakdown, it lowers peripheral fat, decreases visceral fat, which is in between your organs, lowers your cholesterol. Therefore, it's protecting you against cardiovascular disease, helps osteoporosis, cognitive impairment, mental slowness, and memory loss. A lot of people complain of brain fog, and that's what we're using this for. Decreases fatigue, which is our most common complaint, helps improve with weight loss, improves cold intolerance, muscle cramps, muscle aches, and improves a sense of well-being. Most of all, improves your quality of life because it improves your metabolism. Your thyroid is your main metabolic hormone.
Okay. And what are some benefits of DHEA?
DHEA is dihydroepiandrosterone. It's a hormone that's made in the kidneys. It's converted into androgens and estrogens. It's made in the adrenal gland, which is on the upper pole of the kidneys. Studies have shown that replacement of DHEA play a role in prevention and treatment of metabolic syndrome with associated abdominal obesity around the stomach area. Decreased DHEA levels are associated with higher cardiovascular risk in men. It's effective treatment for midlife onset of major and minor depression, anxiety, and it helps improve your mood. It's also been shown to be helpful with your skin. It reduces your cardiovascular risk factors by increasing lipolysis, therefore decreasing your cholesterol and, like I said earlier, peripheral and visceral fat, therefore decreasing atherosclerosis. It helps your insulin sensitivity, so it decreases your insulin requirements, and therefore decreasing the incidence of diabetes because it's decreasing that visceral fat. It enhances your immune system by activating your T cells or your adaptive immune response. Also has some anti-cancer properties, helps improve your memory, increases energy and prevents osteoporosis, restores your sexual vitality by increasing your testosterone levels. And obviously, by doing all of this, it's going to help improve the quality of your life.
Amazing. Okay. Can you tell me a little bit about the benefits of bioidentical micronized pregnenolone?
Pregnenolone is one of my favorite hormones. It's converted into cortisol, aldosterone, DHEA, androgens, estrogens, and progesterone, also in your adrenal gland. It enhances the effects of steroid hormones like DHEA, estrogens, progesterones, and testosterone. It's been shown to improve your memory and cellular repair, especially of the brain and the nerves. It increases energy. It helps deal with stress better because it has a really strong cortisol neutralizing power. It helps protect your brain function against neuronal injury. It improves memory in men and women. It improves spatial memory and perception in men, and in women, it helps improve verbal recall. It elevates your mood by modulating two different receptors in the brain, the NMDA receptor that's involved in learning, memory, in alertness, and helps the GABA receptor that's promotes relaxation, mental slowing, sedation, and sleep. It improves symptoms of arthritis by decreasing joint pain, tenderness, and spasticity. It improves your strength and your range of motion. Pregnenolone has a chemoprotective effect. It's one of the most broad spectrum universal detoxifying enzyme systems possessed by all mammals, including humans. Pregnenolone will also help obviously improve your quality of life.
And what are some benefits of vitamin D3?
Well, we all know vitamin D. We all know vitamin D3 now. It's gotten a lot of publicity with COVID. Vitamin D3 or cholecalciferol is a nutrient that's used by several parts of our body, like building bones, the absorption of calcium. It's also known as a prohormone, which means it's converted to an active hormone form. It's used to treat osteopenia and osteoporosis. It manages your blood sugar levels by working with your insulin sensitivities. It helps decrease muscle and bone pain, and even helps depression. It helps decrease your blood pressure by reducing renin concentrations in your kidney. It improves your cardiovascular endurance by keeping your heart muscle cells from growing too large, so it helps improve cardiac output. There are a lot of medical studies that have shown that vitamin D3 can slow the progression of prostate cancer, colon polyps that can develop into colon cancer. It decreases the risk of several different types of cancer, like breast cancer, colon cancer, prostate cancer, ovarian cancer, esophageal cancer, cancers of the lymphatic system. And it, like I said earlier, it reduces precancerous colon polyps. It helps to modulate the innate, which is the cellular, and the adaptive, which is the antibody-dependent immune systems. So therefore, it has an acute effect on modulating the immune system. So if you're deficient in vitamin D3, you have a prevalence for certain autoimmune diseases like multiple sclerosis, rheumatoid arthritis, even inflammatory bowel diseases, and lupus. It can help you optimize your brain and reduces cognitive impairment, dementia, and prevents Alzheimer's disease.
And what are some benefits of growth hormone?
Growth hormone is the hormone that started anti-aging medicine. The problem with growth hormone is because it works so well, the government tries to limit it. So it's very, very expensive. So it also improves lipolysis, or breaking down of cholesterols, visceral and peripheral fat. So therefore, it's going to really decrease their atherosclerotic plaques that build up that cause the arteries to close down and narrow. It increases fibrinolysis, and therefore it's going to decrease plaque deposition. So it improves plaque dissolution, or the breaking down of plaques. It will help increase your cardiovascular function, increase your cardiac output, increase your energy, and therefore increase your ability to do exercise. It will help improve muscle size, strength, endurance, and decrease in fat. It will help increase your bone mass and your bone growth. It'll help improve your skin, your hair, your nails, as far as growing and thickness. It improves your lung function and your lung capacity. It's been shown to improve memory and cerebral function. It improves wound healing, protein synthesis. So therefore, it's going to improve the tightness of your skin, help decrease wrinkles due to its improvement in collagen and elastin. It's going to help you sleep better. It improves your REM sleep. It brings you into stage 4 sleep faster. And it will improve your immunity, resulting in a decrease in disease, sickness, and cancer.
Amazing. I had a few questions that I wanted to ask. Maybe we could break and do a little FAQ section now. Some questions I had were, Does estrogen and progesterone replacement cause cancer?
Well, that's probably the most common question that we get when it's concerning hormone replacement therapy for women. So the Women's Health Initiative trial found that synthetic hormones increased breast cancer, heart disease, and stroke risk among menopausal women. Researchers told women to stop taking hormone replacement, and anybody that criticized them, were basically told that these risks are very important and you really need to stop taking hormone therapy. So the benefits were outweighed by these horrible risks. And there were two opposing views, right? There are the people that wanted you to take hormone therapy and the patients that didn't want to live with the symptoms. So bioidentical hormone replacement therapy has been shown to actually protect you against cancer. It's very different than treating you with Premarin and progestin. It actually is treating you with estradiol and progesterone. Over 50 years of studies indicate that restoring hormones to premenopausal levels protects women from health risks and encourages well-being. Bioidentical hormones are the safest and most effective way to ensure optimal hormone levels, and bioidentical hormones should not be confused with the synthetic hormones, and they're far superior to their synthetic counterparts.
Thank you so much. So now that we know that, do women need testosterone replacement?
Again, that's another common question. And a lot of the benefits that we get physiologically or for the cholesterols from a higher testosterone come from the testosterone conversion into estradiol. But women make testosterone just at a much lower dose than men do. So Schifrin and colleagues showed that testosterone administration, even in high doses, resulted in increased sexual activity, pleasure, and orgasms in women. They also found an increase in sexual fantasies, masturbation, and frequency of sex. The most important finding was the improvement of well-being and mood. And Golden et al. Demonstrated that testosterone replacement in women significantly decreased carotid atherosclerosis and cardiovascular disease.
Wow, okay. Another quick question I had was, does human growth hormone cause cancer?
This is another huge misconception. A lot of people have heard that growth hormone, if you have cancer, it's going to make the cancer grow out of control. There's a number of misleading studies concerning how growth hormone has been linked to causing cancer, increasing its recurrence or its progression. Devi and colleagues in 2002 looked at how growth hormone markers such as insulin-like growth hormone binding protein 3 are significantly reduced in malignant prostate epithelial cells. The study showed a statistical significant decrease in prostate cancer risk with increased levels of growth hormone.
Nice. Okay. And I have one more question. Does HRT help fight fatigue? So hormone replacement therapy, does that help fight fatigue?
Again, this is probably our most common symptom for men and women. Moda and colleagues in 2006 defined fatigue as an unpleasant physical, cognitive, and emotional symptom that's described as tiredness not relieved by common strategies that restore energy, like sleep. They state that fatigue varies in duration and intensity and reduces the ability to perform usual daily activities. And Colin et al. States that fatigue is one of the most common complaints in medicine. They state that this is associated with a decreased quality of life and increase in morbidity and mortality. In 3 different studies, Cullen, Polakowski, and Jesus et al. Respectively reported prevalence rates of fatigue varying between 40 and 45%. It's likely closer to 50 to 60% due to being underreported, because most people think that fatigue is normal. And we found around 67% of our patients complained of fatigue. Hormone replacement improves fatigue by improving thyroid function, which is our main metabolic hormone. It improves insulin sensitivity, allowing more energy production, and increases in red blood cell production, which allow for increase in oxygen carrier capacity to the blood.
Well, thank you so much. Thanks for taking the time today to answer all the questions that I had regarding women and hormone replacement therapy. I really appreciate it.
Thank you.